And now we expand the conversation with a panel on how smart health systems are reshaping entire communities. Our speakers will be looking at digital health, AI, and community-driven initiatives that are reshaping what it means to build healthier societies. Please welcome to the stage Rizwan Tufail, Group Chief AI and Data Officer at PureHealth, Professor Alireza Haghighi, the Chief Executive Director and Director at the Harvard International Center for Genetic Disease, and your moderator, Ramia Farrage, Senior Producer and Presenter at Forbes Middle East.
Good morning. Good morning, everyone. It's wonderful to be gathered once again at the Healthcare Leaders Summit. Thank you very much. This panel will explore how policy, community initiatives, AI, and advanced tech are reshaping well-being across the region. And Rizwan, I'd love to start with you. Tell us about how AI insights from big health data make care more accessible and more efficient in smart communities.
Fantastic. So I think the first thing that we should do is just think about, when we talk about smart communities and health there, way we think about it is smart longevity, number one. Number two, the questions that you asked about accessibility and efficiency are very, very important. In fact, if we take a step back and think about healthcare today and the challenges, they stem from exactly these words. We live in a world where nearly 3.5 billion people across the world don't have access to healthcare, quality healthcare. We also live in a world where the cost of delivering healthcare is now exorbitant. In the US, nearly 17% of the GDP is actually spent on healthcare. In the UK, with the NHS takes up nearly 10% of the GDP of the country. So we've absolutely got to think about efficiency and accessibility. So number one, in terms of accessibility, digital health innovations are making quality healthcare accessible without or overcoming the boundaries of geography. That means that I can get a healthcare consultation not bound by geography. I don't need to be at a clinic. That's number one. And then on the efficiency, there's a lot of work that is happening right now on data and AI in improving diagnostic and quality of care, as well as on the operational side. So wonderful work happening all across, attacking exactly the kind of problems that you've spoken about.
So we can say that AI is really directly improving real-world patient experience. And despite the huge spending in the Western world, US and UK, many patients are receiving subpar care, and many patients don't have access and equitable access to care, which is what Sheikh Nahyan was discussing this morning in his speech. And Dr. Alireza, tell us about how genomics, AI, and precision medicine shape public health strategies and preventative care in smart communities.
Of course. First, it's a pleasure to be here in Abu Dhabi, being back here, and thanks to Forbes and PureHealth for organizing this. So modern medicine is probably one of the most significant achievements of human being. But with all the achievements that we have had, we are dealing with a healthcare that is not precise. Only in the US, the cost of imprecise medicine is $950 billion a year. And I want to repeat this number. $950 billion a year is the cost of imprecise medicine only in the US. It's equivalent to total GDP of multiple countries in the world. It's almost 20% of the healthcare budget in my country back in the US. It's almost similar in other countries as well. So for the first time now, and Rizwan mentioned inequity as well, like more than 50% of the world population do not have access to any essential healthcare service. For the first time, we are able to generate significant amount of data on life science. That's thanks to genetics, and other omics technologies as well. And not only that, we are able to analyze this huge amount of data. For the first time in history, again, we are able to cure diseases. You probably know that. There are very few non-communicable diseases that are treatable. We have come so far with treating infectious diseases, but when it comes to non-communicable diseases, there are only few. For the first time, we can engineer ourselves the biology of human being to cure diseases. These are significant changes. For the first time in history, we are not only prevent diseases, we can predict diseases long time before any biological change in the body. We can predict cancers decades before any biological problem in the body. And we can plan accordingly. We can predict sudden cardiac death, we can neurological diseases, and many other diseases. This is the first time that we do have access to this kind of basically technologies that can help us. So all this together helps us to change the healthcare from a reactive healthcare to predictive, preventive, and personalized. And personalized is super important here. I told you about the imprecise medicine. So now we're able to do that. I always mention the stats that I think is important for everyone in this audience. Among the top 10 most profitable drugs in the US, 60 to 80% of the population do not respond to them. 10 most profitable drugs in the US, 60 to 80% of the population do not respond. This is imprecise medicine. But we are changing that. And we are in actually a city that I can say is becoming the center of generation of life science data, different types of omics, and it will contribute not only to precise medicine and precision medicine in this country to this population, but also around the world.
So genomics truly shifts prevention from general to personalized medicine, we could say. And Rizwan, tell us about the UAE's regulatory environment. How is it helping to facilitate high-quality healthcare here?
It's a great question. So I think one of the things that healthcare innovators need is they need encouragement, they need guardrails, they need clarity around what they can do when they're driving healthcare innovation. And one of the things that has happened in the UAE, because the UAE has been at the forefront of thinking about AI and governing AI and putting down the guardrails, that just gives innovators that much more clarity around what they can do, which they are then taking that opportunity and driving wonderful innovations. Clinical side, diagnostic side, and operational side. I think the question that, the point that you made around imprecision, diagnostic errors, absolutely. There's so much work that can be done there. If I can just add one more point around what Dr. Alireza said, it is really, really exciting to see genomics data and all kinds of data being able to drive healthcare innovation forward. One thing that we need to make sure of is that the data that is available to drive that innovation is truly representative of the communities that we live in. That's not where we are right now. Right now, most of the data available for model training still comes from the Western world, but there is great hope, great opportunity for this part of the world and our ethnicities to be represented in the data and for healthcare innovations to be fine-tuned for us. It's a huge challenge, a challenge that with the help of the regulator, we are taking on.
Dr. Alireza, can you expand on this for us and tell us how life science data can really help to strengthen the competitiveness of nations?
Absolutely. So I actually refer to data as the new currency of power now. So I call it, I think that the power has new 3 pillars that I call. The first is data. The second is AI to analyze the data. And the third is the energy to power the AI to analyze the data. That is why that this region, and specifically UAE and neighboring countries like Saudi and others, are becoming the center of attention in the world, because they are investing in these three pillars very, very, I would say, in a very smart way. So the significant investment is being done in AI infrastructure. Significant investment is being done in data generation. So here in this specific part, Rizwan mentioned the inequity and in even data representation. So more than 80% of the data that we have now from omics is from people of European descent. There are few projects in the world that are changing that paradigm. One of them is Emirati Genome Program, while the others, in the region as well, we are doing a very nice project in Bahrain. Qatar has a genome program as well. So these initiatives that is started by the government are changing this. So these three pillars, data, AI, and energy that you need for AI to analyze the data, is giving a new competitiveness, basically paradigm to the countries. So now you know that multiple pharma and biotech companies are interested, because that's where the data is being generated. This data is the most valuable data. It's about life. It's about extending life. So whatever we do at the end of the day is to make people healthier and to make them live longer and healthier.
So we have the data, we have the AI, we have the energy. We are short on time.
Exactly. But what I want to say is that these projects are not only healthcare projects. These are more and larger than basically healthcare. It involves all the sectors in the country and give them an advantage in terms of a strategic competitiveness and national growth.
Rizwan, just on that, give us the headlines, the main challenges integrating AI across different healthcare providers. How can we overcome them to create a seamless journey for our patients here?
That's a great question. So look, I think that the healthcare systems and the healthcare facilities in all of the communities are truly responding to the communities that they serve in, the diseases that are there. We will not abstract away from that. What needs to be done is, how do we think about patient experiences and create them seamless by taking one step back? And that's why for us, Pura, which is our healthcare app, is meant to do that. It is meant to be the digital front door that allows a very similar patient experience, irrespective of the healthcare facility that a person goes in. They have clear expectations of how healthcare will be consumed by them, where they can find their information. That is how we're innovating around that.
Okay, I think it's clear that the future of well-being will be shaped by smarter systems, stronger partnerships, and truly connected communities. I want to thank you both for your time today. Thank you for being here.
And thank you very much.
Thank you.